Alright, hi, my name is Jocelyn, this is Mauricio, and I will be performing an oral peripheral exam on him. So we'll start off with the structure and function of the facial muscles. Alright, you're gonna look at me. Alright. There's no visible drooping of the mouth. There's no eyelids partially open or closed. Mandible and jaw. No drooping on either side. No visible abnormal movements. No spasms, twitching. Signs of mouth breathing or drooling. Nope. All clean. Symmetry of face while making specific movements. Alright, I need you to smile. No deviations. Open wide. No deviations as well. Raise both eyebrows. Very nice. They raise evenly. Close your eyes tight. Very nice. Both close very evenly. And now we're moving on to the structure and function of the lips. There is no drooping of the corner of the mouth. There's an adequate amount of tissue. They remain closed while at rest. No visible signs of breathing or drooling through the mouth. Lip tissue appears very healthy. There's no evidence of a repaired cleft lip or other scar tissue. All right, to move on to the functional integrity of the lips, I'm gonna need you to smile. No deviation of either side. Pucker up. No uneven deviation for the puckering. All right, pucker and smile. Pucker and smile. No. Pucker and smile. Back and forth. All right. Range of motion does appear adequate for speech. All right. Puff your cheeks and hold the air for count to 5. Don't breathe through your nose. All right.
Ooh-wee, ooh-wee.
Do it. All right. Ooh-wee.
Ooh-wee, 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 ooh-wee.
All right. Range of motion and strength of lips seems appropriate. Moving on to the structure and function of the tongue. All right, stick out your tongue, please. Coloration of the tongue appears normal. The size of his tongue appears appropriately sized. No visible signs of atrophy. No abnormal movements. Moving on to the functional integrity of the tongue. Protrude your tongue as far as possible. So stay out as far as you can. He can perform the activity without effort. Speed and range of the motion appear appropriate, and there is no deviation on either side. All right, stick your tongue out for at least 5. Try not to rest your tongue on your lower lip. Just your tongue is touching your lower lip. Don't let it touch. Range of motion is appropriate. All right, move up and down, side to side, right and left. All right, range of motion looks good. Excursion is good. No signs of uncoordinated movement or weakness. Tongue looks strong. All right, retract your tongue. It appears adequate for speech. Speed and range is good. Lift tongue so that the lingual. Okay, open your mouth and lift up your tongue. No, like space underneath. I want to see the bottom part. There's no sign of ankyloglossia. All right, I need you to repeat la la la.
La la la.
Range of motion and strength and excursion seem appropriate for the tongue. All right, repeat ka ka ka.
Ka ka ka.
Range of motion, strength and excursion seem appropriate. Ka 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 la.
Ka 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 la.
Range of motion, strength and excursion of tongue seem appropriate. Moving on to the structure of the hard palate. Does the coloration of the hard palate appear normal along its midline? I need to see the top part of your mouth. Looks good to me. Does the height and width of the hard palate vault appear within normal range of speech for production? Yes. Are there any signs of repaired or unrepaired clefts, fistulas, or fissures? No. Are there any signs of surgical removal of any portion of the hard palate? No. Are there any prostheses? No. Not that I can see. Moving on to the structure and function of the soft palate. Does coloration of the soft palate appear normal along its midline? Yes. Looks normal. Wait. Is the uvula bifid? No. Are there any signs of repaired or unrepaired clefts, fistulas, or fissures? No. Are there any signs of surgical removal of any portion of the soft palate? No. Are there any prostheses? No. Does the velum appear symmetrical? Yes. Does the length of the velum appear sufficient for adequate posterior movement in velopharyngeal closure? Yes. Oh my goodness. Moving on to the functional integrity of the soft palate. All right. How was your day today?
Good.
What did you do today?
Ate a burrito.
His speech sounds normal. It does not sound hypernasal or hyponasal. Oh, sorry. Are the pressure consonants produced correctly? Yes. Are there any unusual substitutions such as pharyngeal fricatives and glottal stops for pressure consonants? No. Ask the child. Okay, produce a long ah.
Ah.
Does the vela move up and back to meet the pharyngeal wall? Yes.
Ah.
Yes. That is good. All right. I need a mirror for this one.
No.
What? Non-nasal laryngeal. Moving on to the teeth and related structures. All right. Let's see. Open up. Trying to see your teeth. All right. No missing teeth. No teeth jumbled, tilted, or malpositioned. No full or partial dentures in place. No dental appliances. Looks good to me. Bite down gently and separate the lips so I can see your teeth. Normal occlusion. Bite relationship of teeth is normal. General condition of teeth looks great. And that concludes our oral peripheral exam. Thanks.